It's so important that depression is not overlooked in someone who has been socially isolated or lonely, because it has very significant consequences.
So what is the connection between loneliness and clinical depression?
They are linked, they are connected, because a lonely person can become depressed, and a depressed person can become lonely. If I'm lonely, chronically lonely, over time I become unhappy, discontent, I lose interest in things, I don't have the energy, I become self-absorbed. And it's easy to see how this can slip into a depressed state. On the other hand, if I'm a person who is suffering from depression, and going with depression are symptoms like fatigue, loss of energy, loss of interest in social activities, a tendency to be self-absorbed and disconnect from family and friends, almost inevitably, in time, I would be struggling with the issues of loneliness and social isolation.
So being aware that a lonely person may be suffering from clinical depression is important. It sounds like a person wants to make sure they're not dismissing that so-and-so is not dealing with their loneliness. It's just loneliness, like a lot of people. It does sound like it's important to be aware that a lonely person may be depressed.
I think that's terribly important. It's so important that depression is not overlooked in someone who has been socially isolated or lonely, because it has very significant consequences. On the one hand, the presence of depression will increase the intensity of the psychological symptoms and the psychological experiences of the lonely person. On the other hand, if I'm trying to help a person who's lonely and also has a hidden depression, providing social support is not going to cure their depression. So the depression has to be identified and treated. Indeed, and getting the lonely person into treatment, getting them involved in a treatment program, will in turn connect them to social supports and groups that will have a very positive impact on their future life. So depression and loneliness often go hand in hand, and it's something that we must be aware of when we're dealing with lonely people.
Yeah, so it sounds like overcoming loneliness is incredibly important.
It is, because some of the symptoms of loneliness are quite serious. We have depression. We have a person who can have suicidal thoughts. They're at suicidal risk. Or, to go back to depression, they have a deep depression and they become neglectful of themselves. They lose interest in self-care. They become apathetic. And the problem with depression, if left untreated, it becomes worse. The person becomes more seriously depressed and more cut off and more at risk to the consequences of depression. The problem, of course, is that sometimes there's a similarity between the symptoms of loneliness and the symptoms of depression. And some experts say that perhaps loneliness should be seen as a subcategory of depression, because lonely people are unhappy. Often they lack motivation, they're apathetic, they lose interest in themselves, and have many of the symptoms that we see in depression. So once again, it's important that a lonely person is carefully assessed, that they're referred to a mental health expert, a psychiatrist, if there's any hint of the possibility of a hidden depression.
Thank you.